Gauteng hospitals are said to be running out of beds because of the COVID-19 third wave that we're experiencing. Hani Baragwanath Hospital is one of those hospitals. Vaccinologist Professor Shabir Madhi says the hospital's COVID-19 facility isn't being used to its full capacity. Thank you for joining me, Professor Madhi. Explain what is going on or going wrong when it comes to hospital beds.
So good evening. So I think the major challenge that we face, and this is probably particularly in Johannesburg because of the closure of the Charlotte Macquarie Hospital, which has resulted in a shortfall of 1,000 beds, including probably close on 400 beds that have been previously used for COVID. What we're facing right now is that the severe pressure on Helen Joseph Hospital in particular, as well as on Hani Baragwanath Hospital. Now, this pressure is not necessary simply because we've got a large facility that was specifically built for COVID-19 right next to Hani Baragwanath Hospital, and that facility currently is completely underutilized. So we face with a situation where COVID-19 patients that are requiring oxygen are literally needing to sit in a chair for 2 to 3 days at Helen Joseph Hospital before they can actually get a bed in that particular facility.
Who's responsible for that?
Essentially what's happening...
Who's responsible for that? Why are we in this situation?
Well, the people that are responsible for it are those that are responsible for planning for health in Gauteng, which is the Gauteng Department of Health. So the reason why we're in this situation blows my mind, because we knew that we were going to experience a resurgence. All the indications were that the resurgence was probably going to be possibly as bad as what we experienced the last time round. And the closure of Charlotte Macquarie Hospital didn't happen overnight. It's almost 6 weeks since that hospital has been closed. So there should have been a contingency plan. And seemingly, we haven't bothered to actually put a plan into place to ensure that when we have a resurgence, that we have adequate staff, as well as we've got adequate beds. But for some strange reason, we don't have adequate staff to actually to man the beds that were actually purposed for this particular reason.
Well, I hope the GDE is watching this show, the Gauteng Department of Health, and obviously doing something about it. But I want to broaden our conversation, Prof. Madhi, because yesterday you spoke about the Novavax vaccine and the fact that South Africans it doesn't look like our Department of Health is going to be using it. Now, we know it has to go through a few processes before it gets emergency use authorization. But there is another vaccine, and you've been a proponent, the AstraZeneca one, that has been approved by SAHPRA for South African use. Do you think we should be going after that?
Well, we should have been using it in the first instance, and I think all of the new data around that particular vaccine, and particularly that vaccine combined with the Pfizer vaccine, in fact shows that in all likelihood, if you were to start with the AstraZeneca vaccine and boost the Pfizer vaccine, you actually get a better immune response than 2 doses of the Pfizer vaccine, including against the Beta variant. So it was a complete, again, miscalculation on the part of government and its advisors to actually sell off the AstraZeneca vaccine rather than actually getting the COVID-19 vaccine program rolled out. And this decision was made despite the WHO itself recommending that even in countries such as South Africa, where the Beta variant was dominating, and despite the vaccine not protecting against mild infection due to the Beta variant, those countries should continue using the AstraZeneca vaccine. South Africa stubbornly decided not to use AstraZeneca vaccine, and the consequence of that is what we're facing right now, where hundreds of lives that could have been saved are being lost.
So let me are you able to pick up the phone and say, let's get more of those? Because they clearly are available. We've heard Biden, for example, President Biden from the US say, I'm happy to donate many, many hundreds or many millions of this AstraZeneca vaccine. Are you able to pick up the phone to anyone and say, get it now?
Certainly not as an individual, but government should be making every effort to ensure that they can actually get the vaccines that will protect lives as soon as they can. Right now, we face with a situation where government has decided now to pursue the Sinovac vaccine, which itself has got zero evidence as to whether it will protect against the Beta variant when it comes to mild to moderate infection. The same thing goes for Sputnik 5. Those vaccines, in fact, against the original virus, probably perform less well than the AstraZeneca vaccine against the original virus. So for some reason, not to have used the AstraZeneca vaccine and then blindly to actually decide to actually pursue the Sinovac vaccine, where we got absolutely no evidence how it will work against the Beta variant. Again, I'm not too clear what the thinking is and what the logic is, and who actually advises government on these sort of matters.
But shouldn't you be advising them? Or is that just out of
government chose to exclude a few people from the Ministerial Advisory Committee, myself included, and this has got nothing to do with me or a few others that were excluded. So again, we're not part of the Ministerial Advisory Committee. We've been making our position clear in the media, publicly, that it was an incorrect decision not to pursue the AstraZeneca vaccine. Another completely absurd decision on the part of government was not to actually use a Novavax vaccine, a vaccine which, together with the two messenger RNA vaccines, the Pfizer vaccine and a Moderna vaccine, where there's global consensus in the scientific community that those three vaccines are probably the best vaccines that are around. And yet government and its advisors decided not for South Africa not to actually pursue the Novavax vaccine, which in the country itself was shown to have at least 60% protection against mild to moderate COVID-19 and 100% protection against severe COVID-19 due to the beta variant. Yet government and its advisors simply decided that the Novavax vaccine was not fit for purpose for South Africa, but we would rather use the Sinovac vaccine or the Sputnik 5 vaccine, for which there's zero evidence as to how it would actually perform against the beta variant.
Is this politics, or is this following the science? I mean, I know this is a bit of a curveball because you don't make those decisions.
No, it certainly is not following the science, because any scientist would tell you that those sort of decisions are completely absurd. So it's certainly not following the science.
So what do you think it is? Do you have any suspicions? Why? Why do we do this? Why do we make these sorts of decisions?
I'm clueless. Well, I'm not part of the Ministerial Advisory Committee. I'm not part of government circles. So I'm clueless as to how they come to these decisions and what actually drives the agenda.
Okay, so let me ask about therapeutics. Because you're in touch with what's going on globally, obviously, in the effort to try and resolve or solve these issues, are there any promising studies happening anywhere in the world looking at possible therapeutics, medicines that may help while we wait for the vaccine?
Well, nothing that's going to really assist us in really driving down mortality. So the one reason therapeutics, what is known as a monoclonal antibody, which has got some sort of a marginal effect, I would say, at best, but something which South Africa simply wouldn't be able to afford, and for which there's also there would be a huge demand. So unfortunately, when it comes to therapeutics, our options are limited. I think our doctors and our nurses have done a fantastic job to minimize the number of people that have died of COVID-19 with the type of care that's been provided. But at the same time, the only sustainable strategy to be able to mitigate the severe consequences of infection with this virus is to ensure that we get high-risk individuals vaccinated. And that program should have started in January and not as we're in the midst of a third wave.
Professor Shabir Madhi, thank you very much for your advice and wisdom. Hopefully people who are in decision-making positions and power are watching what you're saying, and hopefully we can have them on the program to find out why they're not making the decisions you think they should be making.